Welcome to the third session of the What is Not Taught in Medical School series. I am Dr. Dhiren, an orthopedic surgeon, along with my colleagues Dr. Mustafa Rangwala, who is a physician in Ahmedabad, but at present he is in USA. We will host this session. The first point you would be thinking why we started this series. We started this series with the aim that in the medical school, we learn in depth how to diagnose, how to treat diseases. We are also taught about prevention and palliation. But when we come in real practice, we realize that we need much more than that. And this series aims to share insights and knowledge that are often not covered in medical training. Now, I request my friend Dr. Mustafa Rangwala to introduce the topic and our star speaker. Before I hand over to Dr. Mustafa, I just would suggest that if you have any questions, please WhatsApp that on my WhatsApp number 97129 25600. Let me repeat 97129 25600. So with that, I hand over to Dr. Mustafa. Over to you, Dr. Mustafa Rangwala. Please.
Hello. I
Yes.
hope I'm audible, sir.
Yeah, perfect. Go ahead.
Okay. At the outset, thanks, Dr. Dhiren for making me a co-host of a topic that is so relevant always. Now, this is a topic which is untouched in medical curriculum, but is of paramount importance when you enter into the medical practice. You realize that you have to face so many issues. And in the recent past, we saw untimely deaths of several dignitaries, to name a few: Dr. Hemant Patel, Madam Anita Borges. And this was something which was unexpected. Was this an imbalance of the work and life in their life? That is a petty dollar question looking to the stress they have always undergone. In search of name and fame, money is definitely a secondary and a byproduct, but we often enter into a rat race. And in entering into that rat race, we often lose the paramount important time of our life. And as one said, even if we win the race, we remain a rat. And when we realize it, it is often too late. To talk about this, we have none other than Dr. Anil Jain, who has been a trailblazer of cardiac surgery in this part of the world, especially Gujarat. If Dr. Denton Cooley was to the world and Dr. Girinath was to India, we can say Dr. Anil Jain was to Gujarat. He has been doing n number of cardiac surgeries right from 1994 when he joined Institute of Cardiology at Civil Hospital, and then shifting from Rajasthan to Sterling to Sal and now his own baby Epic. He has been doing n number of surgeries. And you know the amount of stress he would have undergone because he has answered the ifs and buts of several patients and the cloud surrounding those patients. And you can imagine the amount of toll he must have had in doing so. But still, he is calm and composed, as reflected by his confident smile on the radiant face. So we don't have anybody else but Dr. Anil Jain to talk on this very, very important topic of work-life balance. He has been doing so since the time he started his medical practice. Let's hear from the horse's mouth itself. Over to Dr. Jain.
Sir, you are mute. Hello. No, sir, you are mute. You are mute. Sir, please unmute yourself.
Sambratushni
We are
Yes,
good.
yeah.
I think you can hear me now.
Yeah.
Yeah.
Presentation पे आ जाओ ना, PowerPoint. Can he? क्या खोल रहा
Yeah,
है?
please go to the full screen, sir.
Yeah, I'll go to the PowerPoint. Sir, please unmute yourself. Yeah, can you hear me now?
Yes, yeah.
Yeah.
Can you hear me? Can you hear me? Hello?
Yes, sir.
Okay, good. Good evening, Dr. Dhiren Ganjwala, and good evening, Dr. Rangwala, and thank you for that wonderful introduction. I think in life, the most important thing becomes work, and then after work becomes work and life balance. Now, is it a myth or is it a reality? Let's delve a little bit into this and see what's the real truth. Well, I work at this hospital, Epic Hospital, and I'm thankful to the institution for giving me the place to work and do a good job in my life. We all know hard work is the road to success. Hard work to get admission in medical college, hard work to get admission into PG and specialty course. Then we work hard to master the art of medicine that we choose. We work very hard to get the patients, and not only after we get the patients, we have to work hard to treat them and send them home. Our patients are demanding, and we have to be on our toes to see that we do our best and don't make any mistakes. And finally, all this hard work will lead to a successful doctor. We all remember the oath of Hippocrates that we take whenever when we finish our medical schooling. And in this, if you read, there is a line: "I will take care that they suffer no hurt or damage." And this is what goes or what gets inbred into all of us, deeply into our souls as doctors. And once we take this particular oath, a professional feels that it is his duty to save life at any cost, not in terms of finances, but in terms of effort, time, and hard work. And we always strive to give our patients the best. But this also comes at a cost of our time, which is meant for ourselves or our family, friends, and relatives. I'm sure this is a quote everybody has heard, and it's not new to anyone. All work and no play makes Jack a dull boy. That means if you're going to keep on working, are we going to become dull people? So that means we need to do something different than work. But at the same time, I would like to tell you, but all play and no work makes Jack a failure. If a doctor does not have enough work, then he or she is subject to medic depression, anxiety, and financial crisis. Everyone knows, okay, what are the investments into healthcare establishments? They can at times be immense. And if you set up a big practice and you have no work and you are a failure, then it can be a very difficult situation. Nowadays, we know how much money is spent on medical education and becoming a doctor. And if you don't have work, imagine what it would mean. So let's not undermine the importance of work. So work is bad, life is good. This keeps on happening everywhere. You see it on Google, you see it on the net. Everybody talks about work-life balance. So is work bad and life is good? Or work is also good? Let's look into it. If work is bad, then how are we going to provide for our needs? They may be family, they may be for yourself, it may be for your children, it may be for your parents. Many needs. We all have needs and we need to provide for them. So if we say work is bad, then that's not okay. But working as a life of physician, it can be very demanding. Our field is defined by long hours of work, high stake decisions, emotional and physical demands. It has always a toll on our lives. I'm sure all of you have gone through it. Okay, we face high rates of burnout, depression, anxiety, substance abuse. We have a chronic stress, hypertension develops. We don't do very well in life, become obese, don't exercise, can't sleep enough. All night your phones are tinging. Oh, at 2 o'clock they'll call you up. The patient hasn't passed stool. What should I do? And that is not the best thing for you, but it keeps happening. Sleep deprivation, which ultimately leads to long term health.
Dr. Jain, sorry for the
Yes.
interruptions.
Yeah.
Your slides are not visible. A lot of people are sending me the message that your slides
One
are
minute.
not visible.
1 minute. Why did that happen? I'll just check once again. Uh,
Yeah, but you need to go to the full screen.
share, share it
You're already
again.
there. You need to go to the full screen mode.
Which mode again? Once I'll do it again. Window again? No, no, no.
No, 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 no.
Open
You
that.
just
I don't
open
know.
the presentation and go to the full screen mode.
Yeah, I'll go to full screen mode. I was on the Windows mode. Can you go? This is it. I have to share the screen. Na?
Yeah, you need to screen. You need to open the presentation and then you need to go to the the full screen mode.
Can you see
Yes,
it
now
now?
it's starting, but
Can you
on
see
the
it?
no, you are seeing the windows.
Can you?
No, not yet.
You have to share the screen.
Share it, share it. You have to do just full screen share.
Can you see it now?
No, no.
No. Can you see it, Dhiren Ganjwala?
नहीं फिर से कीजिए सर वही करना
They cannot. You have to first
Not
share
yet.
the screen. Yeah, screen sharing. Stop. See, this is the problem. Entire screen share. Now
Yes,
it is
now we are able
shared,
to see
but
something,
now we
but
have to put the presentation on it.
Now it should be there. Now it should be there.
no, this is exactly. This is the window, and go to the bottom. There is a full screen mode.
Yeah.
Yes, now,
Done.
yeah,
Okay.
done. Okay,
Done,
perfect.
done,
Can
done.
you see?
Yes, yeah,
Yeah.
perfect.
Done?
Yeah,
Okay. So I'll go on with this slide once again. The life of a physician. You know, our job is pretty demanding. It's the medical field is defined by long hours, long irregular hours, high stake decisions. We all know that there's an immense emotional toll. A patient may not be well. There are a lot of physical demands on our work. It has a toll on our health. Doctors face burnout, depression, anxiety, substance abuse. We have a chronic stress, we have poor diet, and at times sleep deprivation, which leads to long term health issues. I'm sure all of you have received a call at night, 2 o'clock. The patient can't pass urine or can't pass stool, and they wake you up, and well, that's difficult. So, there is a very common problem of sleep deprivation in physicians. So there is this paradox of care. We care for others, we tirelessly care for others, but we sacrifice our own health in the process. But that doesn't end at our suffering. It will affect our patient care, leading to higher rates of medical errors and lower patient satisfaction. So that's the irony of our life. While we heal others, where we do so much for others, at time we fail to heal ourselves. That's a real irony. So work-life balance becomes important so that we are good at life and we are good at work both. So it is important, but how do you go about it? The myth is in expecting balance to happen automatically. The reality is that this balance must be designed and defended with intention. It's not just going to happen. You can't say, I want work life balance and it's going to happen. You're going to have to do some real things to make this balance happen. And we'll be talking about all this. So, this balance is not about perfect equality. It's not going to be a 50-50. It'll be a conscious prioritization. The truth is that this balance is not about equality, it's about prioritization. Balance will not be a static point. You will not say, "Okay, today is going to be like this and it has to be like this every day." It's going to be very dynamic, shifting with life season and your work. There are going to be times when work takes more. There'll be times when family will have to come first. And there'll be times when self care is going to be important when you want to heal yourself. Like it's a family wedding or there's a good festival, your family comes first. But when it's full work time and your patient is serious, you may have to go to work. But if you're not doing well, you need to take care of yourself too. So it's about that. So it's not a myth, it's a reality. But it's provided you put your energy into it. It's about having a sense of fulfillment and control over both your professional and personal life. You're going to have to work at it. It's dynamic, it's fluid, and you're going to have to about about this particular balance. The goal will be a sustainable pace for a marathon, not a sprint. So it's not only about work, not about life. You're going to have to balance it somewhere so that you are going for a marathon, not just a 100-meter race. So you got to prepare for that. But when you come to this point that you want to do it, there are going to be challenges. Challenges about work and challenges about life. So one of the most important challenge, which I'm sure you all will realize in time it's happened to us. There was a time when I came to Ahmedabad, we just had simple landline telephones, and once you're off, there was nobody who would get in touch with you. But nowadays times have changed and we are connected by the mobiles 24-hour. So technology and patient portals now blur the line between work and home. Even when you come home, there's somebody calling you. I've sent you reports. There'll be hundreds of reports in your phone, and you can't just escape it. You're going to go through all those reports and try to find out what to do for your patient. So now we can work anywhere. And not only that, people expect that you will do it 24 hours. People even send a message to you at 7 a.m. in the morning that I'm going to send a message to you about my reports. Then 2 minutes later, he will give you a call and say, have you seen my reports? You're still rubbing your eyes. You don't know what to do. And they want to know what happened to their reports. So there is this always on culture that we look at. There is this paperwork. We have this paperwork about signing reports, discharge summaries. You look at emails. There are many things that keep coming. And many times people come home and we finally look at the paperwork, we check our emails, and this takes away your personal time. Many doctors have this guilt. Yeah, what will happen if I take a vacation? I shouldn't take a vacation. And even on a vacation, they want to work. That's not good. And there should be no guilt when you're taking time off. And more than anything else, doctors, like I said, because of our hepatitis Orth, we are trained to prioritize work above everything else. And this makes it very hard for us to set boundaries. Set boundaries. Okay, where does the work end and life begins? Where does the day end? The time has come when you come to your family and you're relaxing. So there's things you're going to have to do to achieve this. First is you have to track your time. You're going to honestly assess where time is actually going in clinical work, in administrative work, in academic work, personal work. And throughout the day, whatever work you're doing, you're trying to finish everything at the hospital or your workplace and not bring your work home. If you have a lot of work that you think you can't finish in the hospital, or there's more work and you're overbooked and it's taking a long time, then you'll have to realize that you have to delegate work. You have to find people to do work. For example, somebody to check all the reports, prepare a summary, and then send the patients to you. So that'll save time of going through 1,000 pages of reports, which every single patient nowadays carries to you. Try to boost your efficiency by putting patient time separate, your time for rounds separate, so that you finish all your patients. In between you can go for rounds, wait for the reports, and come back and see the reports. So if you work in one place, like if you work in a big hospital, you can see your patients, order the reports, finish your rounds, and come back. That way you can save time. So working in a bigger institution, in a major hospital, may save time for you rather than working in private nursing homes. Not that I'm discouraging that, but that is what happens when work-life balance is required. You got to work in a place where everything happens easily. There is this particular Eisenhower matrix. I'm urging all of you, have a look at it. In life, you have to do things in a particular way. It's a beautiful matrix. There are things that are urgent that you need to do. There are things that are not urgent and you can decide you can do them later. And there are things you can delegate to other, and things that you never have to do in life. So have a look at what you need to do in your day-to-day life. And if you're getting very busy, delete some of them and do only the things that you need to do in your life. You have to create a life calendar. You will have to make time for family, exercise, hobbies, and this will have to be non-negotiable. You have to work. Working is important, but at the same time, you have to put your life on a schedule. You have to learn to say no. And honestly, I can't say no to anyone yet. I keep saying yes to everything. If you say, oh, this particular date, Anil, you have to give a talk on work-life balance, I may not have time. Still, I put a lot of my family time into preparing this talk on work-life balance. I don't know the art of saying no. But honestly, saying no has to become a priority in life. If you have other things to do, you have to be able to say no. And when you're at home, try to be at home. Don't try to do work things at home. And mentally detach yourself from work when you come home. Once you're home, it should be home. You should not be still thinking what happened to this patient, to that patient, and what am I going to do tomorrow? What time do I have to go to work? How many cases I have? You have to give it up. Once you're home, you have to switch yourself off. You have to have a regular exercise schedule, good meals, and you have to prioritize sleep. A healthy body and mind are more resilient to stress than what if you don't have enough sleep and you've not taken care of yourself, you won't be able to do that. And I just mentioned hobbies and vacations are very important to recharge yourself. It's very, very important. You have to realize that you're going to need support. If you're very busy as a doctor, talk to your friends, talk to your people. Many times your children, they will need to understand that, okay, this week I'm going to be very busy, or your wife needs to know for a week I'm going to be on night duty. Things like that, you have to talk to your family. They should know what's happening to you. Then maybe they will be open to communication. They will accept what you're doing. You have to speak to your friends. There are a lot of parties, a lot of functions. They may excise you from the social network. So talk to them and tell them, okay, I can't, but then you must go up and make up with them later on in life. Don't just hang them high and dry, and try to still maintain your social circuit, because friends and family are very important for everything. At the end of the day, if you feel you're very stressed, you're going psycho with your work and everything, do go to a psychiatrist, or do try to counsel yourself, ask your family to counsel you, and try to get to a normal thing. What is very important is what hospitals can do for you. They should have adequate staff, people who can write, for example, write proper discharge summaries, get it reviewed, doctors can review it, other people can review it, and it finally comes for signature to you. People who can prepare proper workflow, work charts for you, and tell you what is important. Like pre-operative checkup to be done by lead doctors who can tell you, okay, this is right or this is wrong with the patient. So you don't have to go over everything that's wrong with the patient or right with the patient. And you have to delegate time, delegate work all the time to your colleagues. For example, if I'm doing a CAVG, I won't go down to open the chest, take out the mammaries, but I would have colleagues who would do that much before I go in for grafting. And always try to get some rest in between work time also. So this is about the philosophy about how you should live your life. But how did I fare in my life? I want to give a short glimpse of whether I could balance my work and life. It's very important. I'm going to give you some true life examples. We talk that life is good, work is good, life is bad. It's not like that. You will have to learn how to work and how to love your work. There is no success without hard work. I just said that it's always about coming home, always about doing this, about vacations, about friends, about people. But is there success without hard work? That doesn't happen. There is nothing free in this world. Only if you work hard, you're likely to get success. When I was leaving Chennai in 93, Dr. Girinath, my mentor, he told me, put your head down and work, everything else will fall. That's all I've done. And as a surgeon, my head is always down. And that's all I've done. And fortunately, today, I've done pretty well in my life. So what he said was true. But what he did say was work and everything will follow. That's exactly what I did in my life. So, how hard can hard work be? Love the job you do and never have to work another day in your life. You have to love what you're doing. You have to be also honestly passionate about what you're doing. You should enjoy your work. Then it never feels like work. Even if you are at work, you'll be relaxed, you won't be stressed, you will feel good about it. So you have to love what you're doing. Whatever, as a physician, as a cardiologist, as a doctor, you should love it. In the past 32 years, since I've been in Gujarat, I started in Mayo Hospital and today I'm in Epic Hospital. I switched hospitals, I've had changed workplaces, I made friends all over, and I've done a lot of work in my life. Means type of work that you would wonder, how could somebody do so much work in life? When I started my practice or when I started working in Institute of Cardiology, there was like 10, 15, 20 cases a month. And today, we as a unit, as a team, we do 200 cases a month. It was a tough job to start bypass surgery. Everybody would say, I want to go to Chennai, I want to go to Bombay, I want to go to Delhi for a bypass. Slowly, I had to change the trend and came. So it was a lot of hard work. In my private practice and over the camps that I've conducted to start getting work, diagnostic camps, I must have seen a few lakh patients. With my team, with my group of doctors, with my colleagues, we've done more than 40,000 cardiac surgeries. And we've taken very critically ill patients that nobody would be interested in taking. We introduced new procedures like ventricular restoration, repairs, and transplants. And we did a lot of clinical trials, and I've mentored and trained more than 30 doctors, cardiac surgeons. So over 40,000 heart surgeries. So and other than that, like I just said, numerous camps. Numerous means I must have traveled. There was a time in 2008 or 9, I was out for 42 weekends. So that was really rough on me. Can you imagine traveling every single weekend of the year except a couple and working out, talking to people, seeing patients? It was never rest. I've conducted more than 100 clinical trials, and in which, in few of the trials, I was the highest enroller. I built a lot of institutions. I was part of Civil, Rajasthan, Sterling, Sal. As cardiac surgery grew in the state, in the country, and today Gujarat is one of the leading states for cardiac surgery in the country. So that's a big change. And I was part of this big institution building. And finally, even built my dream institute, that is the Epic Hospital. So how could I do so much work? Why are we worried about work? If you have to work, you have to have a P factor for it. It's about purpose and passion. You have to be passionate about it and you have a purpose for doing it. So if you have to work, you cannot hate your work. Once you start hating your work, it becomes stress. The people who love their work do it stresslessly. So the important thing is the passion. Have passion for whatever you're doing. And doctors, you become doctors with a reason. You have the passion to treat, passion to cure. So we must develop the passion factor, the purpose factor. You have to love what you do. Only then you can do work. Otherwise, work becomes a pressure, a stress, very difficult thing. You will drag your feet to work if you're not passionate about it. If you do not have the purpose of work, it is like that. End of the day, many times patients ask me, why are you looking so fresh and happy? I passionately love being a doctor and more so a cardiac surgeon. That is all I wanted to do in my life, actually. And I love my job. So the bottom line is if you love what you're doing, then you never feel it's hard work. You start enjoying it. I always tell my patients meet me in the evening, oh, how are you looking so good? I said, I love what I'm doing. That's all. So if you love what you're doing, the stress isn't so much as it is if you want. But still, you need to adopt some strategies to do work. You have to build a team, you have to delegate work, there has to be time management, and the hospitals have to help you. There has to be administrative work. You may have a little work to start with, but as your work grows, build your team, delegate work, work around time management. So as your practice grows, as your work grows, you will not suffer with the pressure of work. In fact, you will continue to enjoy it. I built a team and we started it in 97. We have more than 30, 40 doctors now who work together. And I thank this team for all the work that I am at. Thank all my colleagues. I thank the people I'm working with. Otherwise, I would have nothing more to talk about today. I would have been nowhere. It is the pillar of my strength, and I'm sure all of you, if you get together in teams, then you can make your work life balance better. Don't work alone. Try to team up with people. It helps you to share the stress, the pressure, the workload, everything. You can get time off in life if you do have a team. So I would encourage people to create teams, to create systems where you have a sharing of responsibility, sharing of stress, where you can work together happily, and even you can have your personal lives with them. You can share your vacations, your times, your off times with them. Today, our team has been together for more than 28 years, and I really thank them. They've all been part of my life, my work, and we've all worked together. We've supported one another, we've worked with us. So, team not only helps you in doing your work better, but it reduces your stress, reduces your work, reduces your pressure. So, I encourage people, you should create teams. There is a lot of ego issues. We doctors have a lot of ego issues, but let them go, share it easily, and try to work together. It will always help you. End of the day, you will have a life, otherwise you'll have only work. The other thing you have to learn is time management. If you have to work hard, you have to manage your time properly. Like, for example, I always say, I do not travel in the day, I always travel in the night. I take a night train so I can save the day, maybe for work or maybe for spending it with the family. At workplace, I've insisted on having multiple theaters so we can overlap the cases to save time. So that's an example of time management. I'll give you another example. You know, what's my morning schedule? How do I schedule my exercises? So I get up at 7:30 and I sit from 7:30 to 8:30 with my wife for tea. We chit chat. Children come up. We talk to them. 8:30 I will go for a swim. 8:30 to 8:50 I will swim. 10 minutes to shower and then I'm back. A shower in the swimming area. What's the advantage? Anyway, if you're going to swim, you need to have a shower. So I go swim and then take a shower and then immediately go to work. So that saves a lot of time and it sneaks in that time that I need to exercise a little bit. You're going to need strategies for life. So that was about work. If you're going to work, you're going to keep yourself also okay. So there are going to be strategies for you. I said, love your work. You love your work, you do it well, everything is fine. But just by loving work, you won't stay healthy. You won't be able to do that work if you don't have a proper strategy for life. So you have to have this approach, a switch off approach once you're home. That's more important than anything else. Of course, I did say there are other things, but I'm going to talk about them: the exercise, the vacation, the hobbies. They're all very important, and sleep. And I look into that too. Some days, I think about my exercise, my books, my me time. Is it wrong to think about that? I want to travel. No, it's not wrong. It's true. You should have your time in life. It's not always that you have to give it to family, give it to friends, give it to work. On the days that you feel guilty of being selfish, remember that the human heart supplies itself first. And it is by putting itself first that it manages to give life to everything else that depends on it. The whole body depends on the human heart. And all of you know the coronary ostia are the first things that come out of the heart. And it takes the blood first. So you're going to need something for yourself before you start giving it to others. Remember, to take care of yourself, you can't pour from an empty cup. So it's very important that you should take care of yourself. Well, what have I done that? I'm just talking? No, I've done that. I've read a lot. I must have read 4,000 books. Where did I get the time to read books? I'll tell you honestly. When my children were in 11th or 12th, or if they are studying in the room, I would come to the room by 8 o'clock. Until 10:30, 11, I would read in their rooms. So I was serving two purposes at the same time, giving them company to read, and I was also satisfying my urge to read. So something like that. You have to plan, you have to carve out the time for your hobbies, and you have to follow them. I've read 4,000 books. Still, when I travel, I carry a book and I read it when I'm traveling, when I can't do anything else. I love farming. It's like going back to nature, green, everything beautiful. I have a small farm and I passionately grow vegetables. Even today, I've received a big sack of vegetables. If somebody wants some organic vegetables, give me a call. I'll send them across. But I work hard. I love it. It's green. Imagine a small seed is planted, the whole plant comes out, vegetable grows, and you're so happy harvesting the fruits of labor. It's a beautiful hobby. Give it a hand, you'll enjoy it. Music. Music has been my support. Honestly, I'm from the days of ABBA. And ABBA has been my inspiration. Wonderful songs like Winner Takes It All, those type of songs. So I used to love them. Even if I'm sad today or I'm very exhausted, I listen to these songs and I feel good. ABBA, John Denver, Beatles, of course, Kishore Da, you can't forget, Mukesh Kumar, and lots of others. So music is something you can listen to even when you're working. In the theaters, we have a lot of music running. I come home in the morning, evening, afternoon, whenever I get time, I close my eyes and relax and meditate a little on music. Exercise. Today I live in this Sarthi row houses just because of this pool. You see on the left side is the swimming pool of our society. It's a beautiful pool. I have not left this house just because of this pool. You need exercise, you need something to do. I can't go to a club. That's not good time management. If I want to go to swim and go to a club, 10 minutes to drive to the club, do the swimming, come out, take another 20 minutes for 20 minutes of swim. And I didn't have that sort of time. So I've used this pool wisely, well, and I've exercised myself to keep myself healthy. So you have to plan even exercise. This is the other machine I have on the right side. That's the rowing machine. Well, I don't like cycling. I'm worried if I fall, I might fracture something. And walking gives me a little knee pain. I don't want to get knee pain. So I do this rowing. So you have to do some exercise and you have to keep yourself healthy. Traveling is such a wonderful thing. Somebody said, if you haven't traveled the world is like a book. And if you've not traveled, you've not read the book. So I love traveling. I've traveled the world with my wife, with my friends, with my family. And honestly, seeing new cultures, going to new places is such a beautiful thing. It is such a change. But when you travel, make sure that you travel nicely. You learn about the place. You actually get into the place. You should fit into the place, try to see what lives of people is like, what they do. So turn yourself off totally. It is like meditation. You should not be worried about what's going back home. When I travel, I'm not even available on WhatsApp. I don't answer messages. I don't do anything. My phone switched off. I'm just there. I'm there in that place at that moment of time, wherever I am. So that's very important. Not just traveling, but really traveling, the disconnected travel. Sleep is so important. You need to catch at least 8 hours of sleep a day, no late nights. Yeah, that has a sacrifice. You have to sacrifice a lot of parties, a lot of movies, a lot of things that people do late night. But well, if you want to work, when you have to work life balance, you need to do that. You can't work hard and combat stress if you don't have a good night's sleep. I'm conscious about what I don't eat. There are a lot of things I eat, so I didn't want to make a list of that, but I made a list of. I'm conscious. I don't take too much of sev, chavada, fafda, gantia. Abhi gaya dashera. I had one or two jalebis and a little bit of fafda. That's about it. I love everything. I taste everything, but be conscious on what you eat. It's very important. It'll keep you ticking in life if you're careful about it. What was life other than work? It's very important to look at other things. You need to spend time with your parent. Now it's about time. What do you do with the rest of the time of your life? These people are the most forgiving people. If you don't give them time, they won't say anything. But when they're gone, you will feel how I wish I would have spent time with them. Honestly, whenever you get time, give it to your parents. Otherwise, you will live with regret for the rest of your life that you did not give enough of it to them. But they will never complain. They will never come asking that where are you and why didn't you come and see me. So give them time. I have spent time with my parents, but always I wish that I had some more with them. I didn't get enough, but my work was too hard. I was up against a lot of challenges, and I feel I could have given more time, but I didn't give them enough. So make sure you don't make this mistake. I'm not saying it was a mistake. I did give a lot of time, but not enough. Be sure that you give them enough time when you are there around. They will never come back. Time with your better half, and well, that's, I would say, time with my better half and the love of my life, Kalpana. She's been such a beautiful better half for me. She's made me this balanced person. So it's your wife who's going to keep you grounded. But it's very important that she's going to be the one who will let you work and she'll take care of family as she did for me. She takes care of my family. She lets me work. But that isn't all. She has always been with me. She's been with me as an anesthetist when I started at Mayo. She's been part of everything I did. Like when we were building Epic Hospital, I used to come back 7:30 from work, and 8:39 we would call the architect home, and both of us would work together on the plans, the drawings, the meetings. So what happens, we shared the hard work together. It became like more fun than a struggle building the hospital. So if your life partner is with you at that time, it's so wonderful. It's a wonderful experience in life. She is the one who's going to make all the difference to you. If she is happy, it's possible. It's work wife balance, not only work life balance. So things have to balance with wife. So happiness with your spouse has nothing to do with the time available. Don't say, I don't have time, that's why my wife is unhappy. That's not right. If you and your wife are happy soulmates, you will enjoy and savor the time you're together, little or more. Really, honestly, whatever time you give her, whatever time she has, she will try to make the best of it. She will never complain if she's your soulmate and she is really happy with you. But if you're not a soulmate with your wife, be very happy. Don't spend too much time together. It can be dangerous. So be very careful. Do spend time with your wife. Many times people say work is the reason for divorce. I think happiness in marriage is a very, very personalized, individualized thing. If you think you have an unhappy marriage because of work, think again. That's not true. If your wife loves you, loves what you do, she's your soulmate, she's not going to ditch you. She's not going to be unhappy when you come home. I sometimes give her an example of that uh, grocery store guy. His wife happily packs his lunch, dinner, everything at 7 a.m. That grocery store opens at 7 o'clock in the morning. The grocery store guy returns at 9 o'clock in the evening. The wife is waiting with hot food for him. उसके पैर दबा देगी, उसको हेलो बोलेगी, उसको गर्म खाना खिलाएगी. Why? They don't need work-life balance. They also need it. But still, you have to imagine that that man is providing for the needs of the family. So he will get that respect. So always be sure that it's not the work that makes an unhappy marriage. Think about it. So I've spent wonderful time with my wife. We've traveled far and wide in the world. We've celebrated events. We've done things. I was in Jaisalmer and I was offering a locally made. I made something like a bouquet for her and offered it there. I'm traveling, kite flying. I've done a lot of things with her. That's one of the photo on the left upside is when we were studying together in Medical College, Baroda. So we've really traveled together. Make your wife your soulmate. You'll be happy. Share everything with her. Whatever it is, even your patient's information you can share. She'll easily digest it and she'll be happy about it. She has always been with me. She's when I'm stressed, when I'm upset, she comes to me and says, don't worry, everything will be okay. And it really makes a difference. Never forget to spend time with friends and families, your brother, your sisters, your friends. They're very important in life. Do spend time with them. I spend a lot of time with my friends, my teammates. We've traveled together. They've been so we've been so nice. We've been so good as a group. We do everything together. We've traveled, we spent vacations, we've done a lot of things together in this life. And that is what gives the real bondage. If you have a team and you travel with the teammates, you'll bond better, you'll gel better, and you'll stay together longer. So this is a few of us and a few pictures of our travels and journeys. So you can have a team, but to keep it together, you have to put a lot of effort. There is a lot of let go. There's a lot of sharing. There's a lot of caring for one another that actually gels people together and creates a team in this world. What was my balance? I don't think it was a 50-50. I don't think anything like a 50-50 is possible in life. When I came to Ahmedabad in 94, I had nothing in my hands. But today I can thank everyone for what I came. The immense trust and support and love everyone has given to me in Gujarat, Rajasthan, MP. Not one doctor knew me when I came in 94, but I know quite a few now. And I feel for the work I did and the life I lived, it was a fair trade off. So always believe you're not going to get a 50-50 in life. You got to work, you got to do things, but end of the day, if you feel it was okay, that's fine for you. But what is most important is work life balance. That's still going to be important in this 50-50 factor. I want to mention a couple of songs that have touched my heart and inspired me to stay grounded and spend time with my family that matters the most. One song is about children, and I would urge that all of you listen to this song. You can go on Spotify, listen to the song tonight, and read the words and the lines very carefully. The cat's in the cradle and the silver spoon. And that boy always tells his dad, it's about a song about a boy and a father and a son. And the son is always asking the father, spend some time with me. And then the father says no, and the son always says, Dad, I'm going to grow up and be like you one day. And when the child grows up, the son goes visiting him in the city somewhere. And that time the child says, Dad, I'm sorry, I don't have time for you today, maybe another day. There is this one particular story that I want all of you to read. Can I buy an hour of your time? I'm sure many of you would have read this story or know about this story. It's about this young boy who goes to his dad and say, Dad, can I borrow $10 or $20, something like that? The dad fires him. Oh, he's going to misuse the money. I don't know why he wants the money. He fires him. And the poor little boy goes and sleeps sobbing in his room. Later on, his father feels that, oh, I think I have been a little rash with him, a little rough with him. Let me go and say sorry to him. He goes into his room. The boy is sobbing. And the father says, sorry, my boy, here's the money you wanted. He gives him $20. That boy gives back another $20 and gives him $40. His dad used to make $40 an hour. So then he tells his dad, can I buy an hour of your time with this $40? We don't know, but we should know what our children and family feel about us. It's a very difficult question. How are you going to know how your children feel about you? They may never complain, they may never tell you something, but try to find out how they feel about you, about your work. Talk to your family constantly about what you're doing, how you're doing, what are their needs, what do they want. I always say they may never complain, but make sure you give them adequate time when they're growing. It's very important to spend quality time with your children. Very important. Remember that they need your time more than your money, your guidance, or advice. It's time. Time is the most precious gift you can give to anyone. So in work, don't be bogged down so much that you don't give them enough time. They will learn from you. Whatever you do, they will give back. If you teach them that giving that you give them enough time, then when you grow up, they're going to give you time. But if you don't give them time when they grow up, they will forget you when you when you need them. Never come back home. One very important thing is never come back home and complain about your work. Always try to smile, be happy, and tell them how good your day was, even if it was tough. So if you come back every day and say, oh, work is horrible, I don't like to work, I'm having a headache, I want to sleep. If you tell them that same line every day, then when they grow up, they will also never want to work. Teach them the good things in life. Teach them that work is important. Do good work. Don't complain about work. And always take the hardships at work with a smile. That's what's important. It's never going to be a bed of roses, neither for you, neither for them. But it's very important that you do so because you want to keep your children together. There is one other song I'm sure everybody must have heard. आज जवानी पर इतराने वाले कल पछताएंगे चढ़ता सूरज धीरे धीरे ढल जाता है. In this song, they mention that Alexander the Great, when he was taken for his funeral, he said, keep my hands outside. And Why? Because even I am going empty-handed. Remember that even when Alexander the Great died, he could not take the whole of his empire with him. So we have to balance life and work. We're not going to take anything with us. Don't let success get into your head. Don't let money get into your head. Don't let money or success be the only thing that you're running after, the only thing that you run. I have a final reflection after all this big, whatever talk I've given. Work balance in is not about a myth. It's not a myth. It's a choice. You're going to have to balance things. It's not going to be 50-50, but you have to balance it. It cannot be postponed for someday after retirement. It must begin now. You can't say, after retirement, I'll do this, I'll do that. It doesn't happen. It has to be a process. Your entire life has to be about work-life balance. Take small steps and make them bigger as you go towards retirement. True success is not only in saving others' lives, but also preserving your own, your health, your joy, your family, everything. You need to do that. And that also with a sense of purpose. Not that just I came home and gave 2 hours to my children. That's not the right. With good love, with good happiness, spend your time with them. As the saying goes, never get so busy that making a living, never get so busy making a living that you forget to make a life. You make a life for yourself too. I will end it by saying a few things once again, which you need to know, and that's the only way you can safeguard your lives while serving others. Draw boundaries, learn to say no, delegate your jobs wisely, see whom you can trust, the staff you can trust, the doctors you can trust. Trust them, delegate wisely so that you don't get into trouble. Protect your family time, practice micro rest. Like I in the afternoon, when I come out of a case, I can even go to deep sleep for 10 minutes. Sometimes people come and say, "Oh, you were snoring when you were in the doctor's room." I feel bad that I was snoring, but I can go to deep sleep in 10 minutes. Learn how to do that. Nurture your hobbies, whatever it is, whatever you like, cricket, books, music, whatever you can do. Invest in good health. Get yourself checked up regularly, do good exercise, eat good food. That's very important. Not only as a doctor, but as a person, you want to live healthy till you live. And always, you should have the proper definition of success in your head. Beyond fame and money, peace of mind, that is also success. End of the day, if you have peace of mind, it's very important. If you have good relationship with your family, with your spouse, with your friends, it's very important. And that is actually the real marker of success in life, not only your work and its outcome. My father always used to tell me something. He's no more, and I have great love for him still. So when you put your head on the pillow at night to sleep, you should be able to fall asleep easily. If you can't, life isn't worth it. So when you want to sleep, you should be able to go to sleep like a baby. If you haven't done things right, you won't be able to sleep. And if you can't sleep, if you can't even sleep, then there's no purpose to your life. So balance your work and life so that you can get a good night's sleep whenever you want. My father, my hero, is no more, and I dedicate my entire life's work to him. Thank you very much, and whatever questions you have. Thank
Thank you, Dr. Anil Bhai. It was really a wonderful depiction of your work life or a work wife balance. And a life without wife, I say, would not be a life at all. Forgetting the eternal bachelors we have in the country who were really successful, but they are a minuscule as compared to those who are really married and successful.
you. Yeah,
Having said that, I got a very important point that purpose and passion is the main driving force to become a doctor. And I think that was very nicely depicted in Three Idiots. I think if you
yes,
have seen Three Idiots,
yes,
you would
yes.
understand that that was the real movie which I get glued every time it is on the screen. Every scene gives you a message from our college days to the final achievement. Having said that, medical science and medical admissions have become so easy now that if you don't have a purpose and passion, I think you will not be a successful doctor because science is eternally evolving. What is true today may not be true tomorrow. And I think everybody will agree that medical profession is the only profession where you are supposed to give exams every day with every patient. You have to prove yourself. Which other profession requires that? Today you
True.
are successful, tomorrow you might not be successful. And if you have the guts to cultivate that in your life, you are always happy. Having said that, there are so many things that I would like to put on, but I would say that supposing if you're patient is unsuccessful because we just try to appreciate the mother's nature creation, a human body, and medical science just tries to understand that and restore it to normal as far as possible. But having said that, the body may not behave in the way you expected it to behave. So, how is your take on that situation? How do you deal with that? Because you are sitting on a volcanic patient. The patient is supposed to live a life. You are trying to say that he will do good, but you might have also encountered certain unsuccessful situations. How do you deal with that?
Well, honestly, those days are the very sad days. Sometimes, you've done a case, there's some bleeding, the person dies. It's impossible to face the family. There's a lot of stress. But when I come home, when I sit with my family, even after a difficult day, and even if I tell them something like that, they still try to tell me, smile, get ready for tomorrow. It's going to be another bright day. They're so good to me. Even if I come at 11 o'clock in the night, they come down to say hello. So, the only way you can face these challenges in life or you can get out of this is with the support of your wife, your soulmate, and your family. So these difficult days, these difficult times, you just need to work. You need to do your best, and in your heart, you must be sure you did your best. That's all you can do as a doctor. You can't do more than that. You
I
have to leave
totally
it to God.
I totally agree with you because honestly speaking, it is just a confession. Like you have a very good relation with your wife, I do, and everybody must be having a very good relation with their wives, provided they are happily married. So what you do is that when you do a confession, I take it as a confession.
Yes, it's a
Okay, I
confession.
have done this, I have done this. And it is like confessing to God, because she is your soulmate, like as you said. She thinks the best of you. And if she puts you in a positive situation, I think that is nothing more anybody can do.
Exactly.
More any,
That's very important. You have to confess to your family. You couldn't save someone, you couldn't do the best. And I even tell the family, I tried my best and I couldn't do it. So they don't feel bad. In fact, at times, patients come and tell me, Doctor, please don't cry. Okay, you worked hard enough. In your heart, you must feel like that. That's what's very important. And that actually helps you to cope up with the stress of work.
agreed. And on this situation, as far as your field is concerned, I would just like to quote a very simple example, a very true example. My uncle had in 1994, when CABG was in infancy year, he had triple vessel disease and it was 97% blocked, sir. And honestly speaking, he went to Girinath and then, of course, he was financially strong. He went ultimately to Houston, Texas, where Denton Cooley operated upon him. And honestly speaking, the bravery of the patient is very important. Dr. Denton Cooley said that, Mr. Gandhi, you have only one person to be alive on the table. And he was so brave because that time, Adalat, he was taking 6 tablets a day, which was costing a fortune that time in 94, nifedipine. But he said that I don't want to live a life which is so pathetic. So he operated upon him, and the person himself signed, I don't mind if I'm dead. And you won't believe me, sir. He operated and he lived for 10 years after that. So this is the
Amazing.
type of life you give. So at
Yes.
times you give 90% good lives, 10% may be bad because human body as such is something which you cannot think that it will behave the way you want.
Yes.
Anyway, very good. And absolutely, another uncle of mine said that never take your burden of business at home. He was not a profession, but his business. And he lived for 95 years.
True.
कभी भी दुख हुआ, कभी भी shock हुआ, कभी नुकसान हुआ. Never take that to life. Live happily. And that is what it is. So I think
Switch
you
off.
have
Switch
to
off in your home.
switch off phenomena, and you have to always remain happy about what you are doing, satisfied, live life with dignity and grace, and practice success without sacrifice, fatigue without fame without fatigue, and of course wealth without worry. You accumulate wealth without worry even of income tax, right?
Dr.
Having
Rangwala,
said
I'm
that,
really sorry about the slide mess up in the first part. Sorry
no,
about
no,
that. I
no,
apologize
no,
to
No,
come
everyone.
on,
fine. Like,
that
see,
always
technology
happen.
is always like that, and the technology is
Technical
always,
glitch is always there. Technical glitch is always there. Over to
Yeah.
Dr. Dhiren Bhai, I think. My job
yeah,
is done. Dr. Dhiren Bhai, you can say a few parting words.
yeah. So just before we end and summarize, I just would like to ask you, Dr. Jain, you have seen the revolution or the evolution of the communication things. Now, Initially, we had landlines, then we
Hmm.
had mobiles, and now we have later on email and then WhatsApp. And with WhatsApp, person can know whether you have seen the message or not. So,
Yes.
how do you see? Is it a stress generating device to some extent?
No, I have a very simple principle about phone. It's not that I want to be rude with people or otherwise. If you check my phone, it has 1 lakh 100 messages. So I read what I can, I do what I can, I apologize to people. But the important thing is when I come home, I put my phone on silent mode most of the time. So I'll miss calls for an hour. Then after an hour, I will go back, check my phone, take the ones that are important, leave the rest alone. Same way I do for messages. I check messages once in a few hours. If there's something urgent or some friend needs something, I reply that. The good thing is, like I said now, work wife balance. If there is anything, there's an emergency at the hospital, they know my phone is going to be silent and they call Kalpana, okay, please ask Anil to contact the hospital. So that's how I've been doing it, and somehow it's worked out for me. So you have to work out a balance because I still believe the good old days of the landline were better. When you're out, you didn't need to worry, but today things are difficult. But we will have to stay in touch, we will have to answer. But I don't give any medical advice on WhatsApp. I don't think that's a good idea. It's not legal. I tell the patients, you can come to the hospital and see me. Others, they'll keep consulting you for free on the WhatsApp. So I agree, WhatsApp is a tough thing, but we're going to have to take a balanced decision about everything that comes on WhatsApp.
Yeah. So, sir, thank you very much for giving a 360-degree view on this work-life balance. And I know that it's not easy. It's always easy to say something in a lecture, but to apply this is really difficult. And particularly as your practice grows, it really becomes more and more challenging. So, thank you very much for that. And before we close, I would like to sincerely thank our speaker, Dr. Anil Jain, for delivering such an engaging session. Yes, you are right. Initially, for a few minutes, there was technical glitch, but later on, it was really spellbound. My
Thank
special
you.
thanks to Dr. Mustafa Rangwala for moderating the session and asking and introducing the speaker. Currently, he's in USA, but in spite of that, he manages to participate in the session. I am also thankful to OrthoTV for the technical support, for reaching to so many people worldwide. And last but most important, my sincere thanks to our audience. Without them, no program can be meaningful. So thank you very much for that. We value your feedback for today's session. So please share your thoughts on 97129 25600, and also let us know about the topics which you would like to cover in the series. Our next session is on another interesting topic, that's a team building. Dr. Jain mentioned that if you want to achieve work life balance, then developing a team is very essential. And for that, on Tuesday, 7th October, after 4 days, we have another eminent person or speaker, Dr. Parag Sancheti of Sancheti Hospital, Pune. He's going to speak on team building. So I consider this session, the team building, also as a part of one important factor for achieving the work life
Work-life
balance.
balance.
So thank you once again, everyone. Thank you, Dr. Jain. Thank you, Dr. Rangwala, for excellent session. Thank you.
Thank you, Dr.
Thank,
Dhiren. Thank you,
thank
Dr.
you,
Rangwala, for
Dr.
being here.
Thank you, boss. Thank you, everybody. Thank you.
Thank you.
Bye.
Thank you.
Have a good day. Have a
Yeah,
good day. Good. Thank you.
yeah, fine. So now recording is stopped. We are not live stream. We are not on the